So you're Dr. Zarr.
Yeah, Robert Zarr, and I'm a physician, and I also am the president for Physicians for a National Health Program, and we are a 19,000 strong member organization made up primarily of physicians and medical students, and we advocate for single payer.
Why is that so important in this day and age, single payer?
Well, single payer has always been important. It's increasingly important because we still have 42 million Americans without health insurance who are suffering needlessly and dying prematurely. We have another 39 million Americans who are seriously underinsured, and so they're not protected from medical bankruptcy, even though they have an insurance card in their wallet. And even though we have some improvements with the ACA or the Affordable Care Act, we have enormous holes in their coverage and, of course, in the millions who still are suffering and dying because they don't have access to health care.
And what's it going to take to fix that?
What's going to take to fix this problem is very simply taking a piece of legislation that we already have in Congress now, which is H.R. 676, expanded and improved Medicare for all, and passing that into law. So we have right now about 51 co-sponsors, and that needs to be the law of the land. That is the easiest, most efficient, most cost-saving, most affordable way for us to cover every American without bankrupting our country and ourselves.
And Dr. Zarr, what is your experience personally with what you're seeing out in the field with the folks that you're treating?
Well, I'm one of approximately 800,000 licensed physicians in this country, and we see it every day. We see the needless suffering. We are struggling to do some of the simplest tasks you can possibly imagine, like writing a medicine. I can write a prescription, but I have no guarantee my patient can fill it. If they show up without health insurance that day, on that particular time that they're ill, there's no guarantee that I can actually help them in the manner I want to. So my message to physicians is, although the majority of physicians support the creation of national health insurance, my recommendation for those physicians is act on it. Organize amongst yourselves and act on it, and talk to your legislators and get them to co-sponsor H.R. 676, expanded and improved Medicare for all.
And what are some of the key things they can do to help them organize?
Well, one of the simplest things they can do is join Physicians for a National Health Program. It's a ready-made group. We have an incredible source of information that we can share on our website, and even share in much greater detail if you're a member. And that website is www.pnhp.org.
Thank you, Doctor, for speaking to us.
Thank you so much.
Jill Stein, please tell us a little bit about single payer and why it's so important.
Well, single payer is basically a health insurance system that's run for people and not for profit. And it treats health care as a human right, not as a commodity to be sold to the highest payer. And, you know, to know what's good about it, just look at the crisis we're dealing with right now in healthcare, where even under this so-called Affordable Care Act, which is not affordable and it's not really caring either, if you have a true chronic disease, if you're really sick, there will be all kinds of holes in the plan. It hasn't reduced medical bankruptcies, it has not improved our health, and so on. This system that we have right now, 35 million people still don't have health care. Those numbers will go down a little bit, but not all that much. And as more people get insured, the number of underinsured grows. So the plans are stripped down, streamlined plans with high deductibles and co-pays and narrowed networks and all kinds of barriers to care, financial and otherwise. So again, it's a system modeled on Massachusetts, my home state, which we called Romney Care because it was the workings of the Republican Party. It was a bill that was written behind closed doors by the insurance and pharmaceutical industries. I can tell you how it started because I was there. It wasn't seen by the public until the night before the vote in the legislature. A 145-page bill was basically voted on sight unseen and passed almost unanimously. So this is marching orders from the financial industries, from the pharmaceutical and insurance companies. And it's not doing the trick for people. victory was snatched out of our hands many times. If democracy had anything to do with this, we would have a Medicare for all system right now. That's what people want over and over again in poll after poll. Strong support for Medicare now and for expanding it to cover everyone. It would save us an enormous amount of money. About $400 billion is wasted right now on paper pushing and bureaucracy and this massive private insurance bureaucracy, basically, that contributes nothing to health care. So we've got the model, we've got what we need, and we're here today to mobilize.
We have to be very clear. One thing I learned during the healthcare fight in 2009-2010 is that we have a healthcare crisis and we need the ICU. And that stands for independence. We have to set the agenda independent of the political parties. We can't follow their agenda if it's taking us down the wrong path. We set the agenda. Right. We have to be clear about what that agenda is, because the propaganda tells us that the ACA is universal, affordable, and guaranteed. It is none of those things. We have to understand that single payer is the smallest increment of change that we can make to go in the right direction, and we have to be uncompromising. No longer are we going to say, we'll accept this little piece because maybe we'll get more later. That has continued to take us down the wrong path. So independent, clear, and uncompromising in our demand for single payer, and we have to understand that single payer is part of the broader struggle for social, economic, racial, and environmental justice in this country. And as Dr. Stein said, when we come together, we are an unbeatable force that can change the political will of this country, and that's what it's going to take to overcome these industries. So with that, I'm going to pass.
Dr. Margaret Flowers. I'm here in Washington, D.C. Around the 50th anniversary of Medicare at the Healthcare Justice Rally, and this is an exciting time for us. There is a vibrant movement here that's pushing for Medicare for all in the United States. That was the intention of Medicare from the beginning, that it actually be expanded to everyone. Instead, we've gone in the opposite direction with more privatization. And I think what's interesting in this country and why healthcare justice rally is so important is that people don't even know what healthcare justice means. We're so used to a privatized system with barriers to care. We don't understand that most of the other industrialized countries don't have those barriers. When you have a health problem, you can go and get treatment, get the care that you need. And so that's why talking about this, telling the stories of what happens here and how that's so abnormal that people here suffer and die unnecessarily for lack of access to care is important. The United States is already spending twice as much per person on health care than most of the other industrialized nations, but we don't have good health outcomes because we charge so much money up front through premiums for insurance, co-pays, deductibles. That means people don't go when they get sick. So the solution is a really simple one. We have a traditional Medicare system, not the privatized Medicare Advantage, but the traditional Medicare. If we expanded that to everyone, we paid for our healthcare system through taxes, and it was a completely universal system with no upfront costs. You just go, you pay your taxes, and you're in. You go to the, get care when you need it. We could actually cover everyone, provide comprehensive benefits, improve our health outcomes, and reduce our healthcare spending over time. So the answer is really simple. It's expand Medicare to everyone now, and then let's work on improving it, making it a better healthcare system. That's the only thing that's really going to turn us around in this country.
That means single-payer healthcare. If democracy counted, if democracy mattered, we would have Medicare for all right now. We deserve nothing less.